Hey, it's Jessica DaMassa with WTF Health. I'm here at HIMSS 19 at the Together.Health event. And joining me right now, I have Shaye Mandle. He is the president and CEO of Medical Alley in frozen, cold Minnesota.
You know, it's snowing a little bit there today, but we know how to handle it.
I love the mean streets of Medical Alley. So to give us I guess, like an introduction to what you guys do. And are they really such mean streets, or is this more like a friendly Sesame Street version of?
You know, I think as mean as we have to be.
Yeah, Minnesota mean.
That's right. So Medical Alley, we see ourselves as the global epicenter of health innovation and care. You get companies like Mayo, Medtronic, United Health. We've been bringing together those organizations for almost 35 years. And we see ourselves as being in the middle of the kind of transformation that we're covering here at HIMSS. So we have a lot of companies from Medical Alley here across the digital health spectrum.
Awesome. And so, I mean, it's interesting because, like, you did list off some huge healthcare companies from the U.S. And it's like, what kind of was, I'm curious, are you talking at all to Target? Are you talking to Best Buy? You've got some big companies that are consumer businesses that are getting into health up there, too. So are they joining in on the mean streets of Medical Alley?
So I think we're starting to see some creep. So we've traditionally, Medtronic, Boston Scientific, Abbott, none of the companies you mentioned are actually members and participating with the organization.
Okay, so no Target, no Best Buy?
No, not today. But
where are you guys? Come on.
But we are seeing, Best Buy has done a couple of recent acquisitions. They've appointed a couple of healthcare people to their board, and you can definitely see them being a part of the conversation with these other companies.
Without a doubt, I've interviewed a couple folks about the Best Buy, their acquisition and how they're trying to bring healthcare into the home, and they're using device in that way and kind of leveraging that Geek Squad business model in order to do so. So I'm surprised that they're not talking to you guys.
Yeah, well, we're we're having some conversations, and I think they're being really strategic, and they do see what they've built for the consumer industry and how that translates to health. So, I mean, one of the things I like about Best Buy's approach is that they're looking at ways they can be uniquely valuable as healthcare changes. And I think they have some really good ideas about what that means for the company.
Do you feel like they're missing from the conversation that you're having? I mean, we're here at this event, this Together Health event, which is all about bringing together all of the players across the ecosystem. So no matter who you are, payer, provider, startup, VC, I mean, government, we've got big health plans, big health systems, and also consumer tech companies here as well. So, I mean, do you feel like you're kind of missing something by not having them contribute to this conversation with some of these phenomenal, I mean, like United Healthcare is the biggest payer in the country. How are they not talking to Target, where I buy the majority of my stuff? Like,
we're definitely missing them. I mean, I think, as we all look at healthcare changing dramatically and really actually not just reaching the patient, but the consumer and seeing those terms differently. Yeah, I think we're missing, engaging with everybody that can have an impact on that.
Have you been able to, I guess, I mean, in your position, and you're leading this body of obviously healthcare companies, have you been able to shift the conversation more to a consumer, like the consumerization of healthcare kind of conversation in a way? And I mean, if so, do you feel like maybe the reluctance on some of these consumer companies is that they don't feel like yet they can contribute to a healthcare conversation? I mean, they can contribute on the consumer side all day long, right? Buying habits and things like that. But I mean, and even behaviors, which is like, okay, that to me starts to come, cross that border into healthcare, right? We're all talking about healthy behaviors. But do you feel like they may not feel like they can contribute to like a truly medical or health conversation?
I think what we've seen is both traditional healthcare and traditional consumer sector. I don't think it's that they don't think they can contribute, it's how they do it. So, okay. Med tech companies, pharma companies, the patient's always been the center. Yeah. And privacy's always been the center. Now flip to defining someone as a consumer instead of a patient. I think there's different language, how companies promote themselves and the kind of information they collect. You've just got these two silos. And I think they're looking for ways to start to bridge that gap. But in the, companies have been around for a while, really established in both those industries. The rules are just completely different.
Yeah, without a doubt. So talk to me, I guess, a little bit about the conversations that you are having. Give us like a fly on the wall. If we were to listen in, what are some of the hot topics that are up for discussion with the companies that you do have at the table, which, like we said, are, no small potatoes here. You got United, you got Mayo. So what are they talking about?
Yeah. I mean, definitely looking at ways to get to more value-based arrangements. So not just, I mean, yes, improve outcomes, lower costs, but there are tons of inhibitors that have been put in place over the years that really keep some of those agreements, right? Some of it's privacy laws, et cetera. So we're spending a lot of time trying to evaluate, what are some of the inhibitors to more disruptive technologies or some non-traditional players coming in. And we're seeing a lot of attention on some of those traditional companies actually investing in the kind of companies that are here at HIMSS to try them out, make the investment, do some pilot projects. We see payers doing that. We see providers doing that.
Okay. Is there anything in particular, like any dirt you can give us on what they've done? No, I'm serious because, okay, great. So we're going to talk about values-based care. Like, how do we do value-based care? Okay, so what's the next, after the big question has been asked, when you get into the meat of the conversation, give us some of the little nuggets that are coming out. I mean, I'm curious to know if we were a fly on the wall, what's the gossip we'd walk away with?
I think the biggest struggle right now and what everyone's really working on is defining cost within delivery. So
say more about that.
So it's kind of like higher education, right? It's the one sector where really defining what something costs, is
whose cost, right?
Right, is different than what it will be reimbursed at. So I think we see a lot of interest in using data and new data platforms to really scope out what healthcare costs, to empower the conversation about how we lower costs, improve outcomes. The cost basis, which exists in every other industry, is something that just has far too many variables, and we see a lot of interest in finding out that answer.
Okay, so you may not know this, but I'm a total health plan nerd because I used to work at a health plan, and so I'm going to dive deep on this because I want to know. You've got United sitting there. Are they at all looking in the mirror like, perhaps the thing that needs to innovate is the payment model? Are they looking at it in that term, or are they just still at the, we can't figure out how much this costs really, but when they look at it, no, you can't, and you're part of the reason why. Are they asking themselves that hard question about whether or not the payment model needs to innovate as well?
I think every sector of healthcare is asking themselves that question. I think the difficulty
is the payer, though.
Sure, absolutely. No, for sure. I mean, I don't think there's any sector that thinks their sector is fully the problem or the solution. And so I think one of the challenges is interdependency across multiple sectors, right? So, and this is why we've really tried to get people in a room to break that down. But I mean, I think every sector, yes, the payers, yes, the providers are asking themselves, what's wrong with our model? How can we be more innovative? But also, who do we have to talk to in other sectors to really maximize what that looks like? Okay,
and in the talking to in other sectors part of this, I want to jump off of that and talk real quick about Together.Health, which is where we're at here. This is rebranded from the Digital Health Collaborative into a much better name, which is actually sounding much more inclusive, right? Together.Health. And so talk to me, I guess, a little bit about how you feel like an organization, like a little organizing body like this that can bring together all of the neighborhood ecosystems, the alleys and the streets, if you will. If we can bring in the perspectives of those and kind of have a bigger conversation on more of a national level, how do you think this is going to impact our ability to innovate within healthcare?
I think it can really dramatically help to create the definitions of what we're looking for, problems and solutions that can be used across the United States. I mean, you've got leaders from each of the different communities with, some areas of expertise, right? So our community's got, more size and scope than other communities where there might be more novel technologies. And so, I just think us all getting together and being willing to share gives us an opportunity to go back to many of those companies and help them to understand what, why they need to take a look in the mirror, as you said earlier.
Awesome. Well, thank you so much for joining us and sharing your perspective. It's a pleasure to speak with you. I'm Jessica DaMassa with WTF Health here at the Together.Health event at HIMSS 19. Thanks for joining us.